March. Let's talk about sheltering. The goal? Know how to respond safely when instructions are given to evacuate or to take shelter. In a disaster, you may be asked to either evacuate or shelter in place. In the excitement of an emergency, it can be difficult to focus on what you're doing. Know what to do to keep your family safe. Practice your tornado and fire safety plans. If your family has practiced, they'll be more comfortable doing what it takes when the emergency actually happens. Choose one of the following things to do this month to become better prepared. Identify the best storm shelter in your home and practice getting to the shelter with your family. Choosing the best place in your home or workplace to shelter from a tornado isn't always easy. Many newer buildings don't have a really good shelter area. Use these rules of thumb to always find the best tornado shelter possible. First, stay away from windows and skylights. Shelter down and in. Put as many walls between yourself and the outside as you can think of, and remember the ceiling counts as a wall. Avoid all rooms with big ceiling expanses. Find an area large enough for everyone to stay comfortably for at least 45 minutes. If you live in an area prone to hurricanes, be prepared to protect your family and your property. Cover windows with plywood or hurricane shutters when a hurricane warning is issued. Don't use tape. If you're advised to evacuate, then do so. Otherwise, stay inside and away from windows until the storm has passed. Learn how to safely shelter in place. In an emergency like a chemical spill, you may be told to shelter in place. What this means is to make the place where you are a safe place to stay until the danger is past. Shelter-in-place orders are often given when it would be dangerous for you to go outside. Notification. Warning sirens may be used to warn people that it's not safe to be outside. Emergency responders may go door to door in the affected area. They may also use loudspeakers from police or fire agencies to give instructions from the street. Information will also be given over television and radio using the emergency alert system. What to do in a hazardous materials incident? The first thing to do when a chemical spill or similar event occurs is to get information. Turn on the television or the radio. Find out if your area is even affected, and if so, what steps to take. Never call 911 to ask information about an emergency. Only call 911 if you are injured or need assistance. If you are told to shelter in place, do so. You should cover all doors and windows and shut off fans and air conditioners. Take your family to a room with as few doors and windows as possible. You may be told to put towels or tape around the cracks of the windows and doors. Follow emergency instructions carefully. Listen closely. Make sure you take a battery-powered radio with you so you'll know when the danger is past. Power in your area could be shut off during the incident and could be shut off for some time. Make a go bag for emergency sheltering. Emergency shelters will be opened when people are displaced from their homes. In most areas, emergency shelters are operated by the American Red Cross. At the Red Cross Center, the Red Cross will provide you a cot to sleep on, meals and water, a nurse for basic care, and information about the disaster from public officials. However, you may need to bring with you a pillow and a blanket. Bring your identification and a change of clothes, cards and magazines, comfort items, all medications and medical supplies, or at bare minimum, a list of what you are taking and the doctor's names. Remember, never allowed in a shelter are weapons, alcohol, and pets except for service animals. And the Red Cross will never provide information about you to anyone without your permission. And there is never any charge for emergency sheltering.